Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Well, most kids are out of school, and it is the time of year where families pack up and head out on vacation. But before you go, you need to make sure you've taken the necessary steps to keep your health in order and stay safe on vacation. And that's especially important when traveling overseas. And here to talk about this is Bruce Spiller. She's the Director of Occupational Health and Foreign Travel Clinic at Parham Doctors Hospital. Bruce, thank you for being here.
Thank you.
First, is this something that people really need to think about? And there's such a rush, especially when traveling overseas. What do they need to do before they head out?
Well, many international travelers don't think to look for advice before they leave the country from a knowledgeable professional. Vaccine preventable diseases are the best way to prevent travel-related illnesses. Vaccines are one of the greatest public health efforts of all time. A lot of people go to the CDC website and look for information, and that's really helpful, but it doesn't tailor the vaccine needs to the individual traveler.
So you recommend that folks actually go to a doctor, say this is where I'm traveling, and then they can put out a whole regimen for them before they leave.
It's even better that they call a place that specializes in travel medicine. You don't have to make an appointment and just come in. We start with a pre-travel consultation on the phone to get a feeling for where you're going, how long you're going to be there, why are you going, what you've had before. There's a whole lot that can be covered on the phone before you make the effort to come in.
And it's probably better than just a Google search, right? Because each country has different issues.
Each country has areas of disease risk. Some have more disease risk than others. Long-stay travelers have greater risk than some people. But everybody, before they go out of the country, should at least touch base and find out what the recommendations are from the CDC.
And is it also important not only for that country that you're headed to, but if you have a particular health issue that you're dealing with, maybe you're taking medication for heart disease or something along those lines, to make sure that's all in order as well?
There's many other health conditions besides vaccine preventable diseases, but when the patients come into the travel clinic, we're able to address many of those or direct the patient back to their family doctor to cover them.
And is it a good idea to maybe start with your family doctor and they can then transfer you over?
A lot of our referrals actually come from family doctors, but we welcome calls from patients even prior to that.
Okay, very good advice, and good advice before you head out, not after you're already there. All right, Bruce Spiller, thank you so much for joining us.